welcome. I'm Dana Humphrey. I'm the Associate Director of the Coalition. You've probably seen my name in your inbox. You might be a little sick of seeing my name in your inbox, and today you'll be sick of seeing my face because I will be your MC, so I'll be up here a lot. It's so wonderful to be here with you all after many months of planning, and wonderful to see all of your faces. And when we move into Q&A, just so you know, I'll be passing mics. My colleague Anna and some other from the AV team will also be passing mics, so look for us on the sides of the room. To kick off the day, we are hearing from a panel of Chief Wellbeing Officers from 4 institutions across the country who will discuss how colleges and universities are evolving their approach to student mental well-being. Moderating this discussion, Dr. Zoe Raguzios, NYU's Vice President for Student Mental Health and Wellbeing. Zoe leads both clinical and well-being initiatives across the university, working to embed a culture of flourishing as a core institutional value. Zoe has been an invaluable partner in bringing this event to life, and I know she'll bring deep insight to this panel as well. So join me in welcoming Zoe.
Good morning. Lovely to see all of you this morning. Before we start our conversation, I wanted to extrapolate very briefly on what we mean by moving from mental health to well-being. In essence, this panel is about the future of student mental health in higher education. It is common knowledge that college counseling services face increasing demand and that mental health issues on our campuses impact student success and retention. Certainly, clinical services and clinical service provision continues to need our attention. Which students we treat, how often we treat them, is really important in achieving our goals. This being said, clinical care is only but one important component. A campus-wide mental health model and a shift away from the clinical model whereby we treat students who come to our attention or who voluntarily come through our doors, to a public health approach whereby there are elements of well-being that we charge ourselves with teaching our students, that are infused into our mission as colleges and universities, that are in the water, that are in the curriculum for every student simply by virtue of them being enrolled. This is our charge. A shared responsibility across faculty, staff, administrators, parents, neighbors, all community members. And to ensure that this is a coordinated mission, more and more colleges and universities have established senior positions to envision, strategize, and execute this public health strategy that touches every one of our students. How we do this is no simple feat. And so I'm joined by 3 colleagues here this morning so we can hear from them exactly how we execute a public health well-being strategy for the benefit of every one of our students. And we have a whole 40 minutes to do this, so let's get started. It's my pleasure to introduce Betsy Krakow, Associate Vice Chancellor of Campus Life and Wellbeing, University of Massachusetts Amherst. Candace Epps Jackson, Assistant Vice Chancellor of Student Affairs for Health and Wellbeing, Winston-Salem State University. Esteban Garcia, Chief Health and Wellness Officer, Dartmouth College. Welcome. We're first up. We have to give them a wow moment. So we all know that responsive clinical care is never going to leave us. There are students who are going to come to our attention. There are students who voluntarily want our services. But I wonder your thoughts about the opportunities that the public health model allows for us to be innovative on our campuses. And I wonder if you could talk very briefly about one initiative that you're particularly fond of. And we're going to start with Betsy.
Great. Nice to see both of you, by the way, and all of you, and humbled to be here with you all. Again, from University of Massachusetts. I'll start with just a brief story. We did an all-day mindfulness retreat on Saturday. And if any of you are yogis, you may know the name Rolf Gates. Your yoga teacher knows that name if you don't. He's brilliant in a very subtle way, had us meditate. There's 100 people in the room in our old chapel, and he said, pay attention to, this is what it feels like to be in a room of people breathing. And then later on in the day, pay attention, this is what it feels like to be in a room of people focusing. And that really caught my attention. He uses the phrase that where we place our attention is our life. And that is a little bit reminiscent of the talk last night. And then at the end, it was, this is what it feels like to be in a room of people resting. And so this idea, I think from a public health perspective, yes, coalition building, yes, community. And by the way, coalition building in my mind is about feeding people and having them talk to one another. And so we do a lot of that at UMass. Is an embodied experience. And so when we think about the number of students who are running down to the counseling center specifically for the groups that involve the dogs, more so than the other things, when the students are really fascinated with coloring, right? When they're going to the yoga and meditation, I think it is a craving for the physicality. Our numbers around intramural sports are through the roof. And so I think some of the innovation is really, we can talk about our resilience programs and our courses that have had great outcomes, but it's really about everything old is new again. What are the biggest levers that you have to touch your students from a population level? At UMass, it's residential life. So we have one of the highest residential populations in the country. And so our RAs, where once were more oriented to compliance, are much more oriented to connection. And that's been very intentional. So there's snack cart conversations. They wheel their carts down the hallways and knock on doors and have snacks. It is the art of community building. I would draw your attention to Vivek Murthy's recent writing on the final prescription, parting prescription for America, which is to say that the crisis of well-being is a crisis of community. And so much of what we do, and I can talk more specifically, is about doing that in the everyday ways. How we lead a group fitness class is not just about your glutes, right? It's about turn to the person next to you and introduce yourself. So I'll leave it at that.
Thank you. Candace, your thoughts?
Yeah, okay. Good morning, everybody. I agree with much of what you've said, Betsy. We have really, I've been in my role, let me say, about a year and a half. And so when I came in, counseling services was very much the center of our mental health work, right? And so we know that in order for us to truly take this public health approach, there needs to be some recalibrating. We need to see health and well-being work as everyone's work. And so at our university, HBCU, we've navigated some funding challenges. We've addressed performance metrics or underperformance so that we can meet those performance metrics. All that's tied to funding, right, and enrollment and graduation. And so that language has become everybody's language, right? We see enrollment and retention as everybody's work, right? My work was to build coalition around health and wellness as being inextricably tied to our retention efforts, our student success work, right? Matriculation, graduation rates, all the performance metrics that our UNC system is looking at, right? And so I had to be able to speak the language that the community had adapted around retention efforts, right? But tie it to health and wellness, right? Give them data to help them see, not just national data, because we know our students at an HBCU aren't always truly represented in some of our national data samples, right? But to give them some of that national data, to give them our university data, and to really help them to be able to see that now we have to do this as a community. And so what that has really looked like is me decentering counseling services, right? One of my portfolio areas, and really leaning into lots of outreach, education, and training for our faculty and staff as well, and providing those opportunities for people to feel empowered, right, to not act as pseudo-clinicians. That's not what we're asking you to do, but to understand that the call is for them to develop empathy and humanize students and just connect with students. So I'll stop there.
As a counseling service director for many years, it felt strange to try and take away the spotlight from the counseling services and disseminate it across campus. But I realized that if you only provide students with the option of going to see a licensed professional, then that's what they're going to do. And many of those students don't need to be there. So we're stressing out the counseling services because we're putting students in front of them who need just the dogs, or who need more feelings of belonging, or some career counseling related to their purpose in the world. So that's why, the dissemination is so important of the attention and the public health model. Esteban, what do you think?
Sure. Thank you. So I'm new, I think even newer. So new to higher ed. I've been at Dartmouth about 11 months. And what a time, right, to join higher ed. I came from state government. I was the chief medical officer in the Massachusetts Department of Public Health for a couple of years, and with a real focus on trying to get our patients that were utilizing emergency departments. I'm a pediatric emergency medicine doc, trying to get them out of the emergency department and maybe prevent them from coming into the emergency department. Oftentimes they don't, you don't need a clinical care, or potentially you don't need emergency care, you need clinical care, and so we're working on that. At Dartmouth, I will say that the idea, I moved, my portfolio is new, I report to President Bylock, and what I did was I moved our counseling center out from under the Student Health Center, and I think that for me was very important, because while they were functioning independently, it was really a matter of giving them the same standing, and so that students understood, so that families understood. It's not clinical care. It really is this wellness approach. And by doing that, we were able to then build in wellness across the campus. We have a huge housing initiative now, and I don't know why in rural New Hampshire. I really don't know why in rural New Hampshire there is not enough housing, but there is not. I understand in New York, but there's not enough housing, and so we are working now on partnering with our facilities SVP to integrate housing wellness activities as we build new dorms and new residential environments. So that's going to be really important. And now we have a way to do that and decentralize our wellness center. It's centralized now. We will be decentralizing it as well, so that it's in all of the new buildings. And then, of course, we'll have things like teletherapy and other things that'll be available in the new buildings. But that's part of the communication, which I think is really important, and giving wellness the platform that they need on campus.
How do we make sure that every single one of our students is touched by our well-being efforts? If you imagine, there are the students who are going to sign up for the time management seminars, or the stress, right? And so those are the ones who could certainly benefit from it. We all could, but they're not the ones who need it the most. It's the student who will never sign up, the student who commutes, perhaps the student who still lives with their family, the student in the calculus class who sits in the back in a 200-person lecture hall. How do we get to that student? Betsy, what do you think?
We're fortunate to have a provost office so invested in well-being, and so 2 years ago, actually under the direction of Tricia Serio, who unfortunately left us, but we have so many good people, started something called EAPs, Equity Action Plans, and looked at best practices, particularly around belonging in the classroom. So, you can't separate out DEI, belonging, well-being, and really charged department chairs with, here are 12 best practices. You can go to a workshop at the Center for Teaching and Learning about how to do this practice in the classroom. And at the end of the year, you will report back and we will remeasure. And that process is ongoing right now, happening in real time. The impact of that, but a lot of it is turn and talk to your neighbor in the class. It's getting to know your students' names. Again, very basic, but I think that's the touch out to those students who might not seek counseling services. We also are working with our tutoring center. They see thousands and thousands of students who are in there literally having panic attacks, not all of them, of course, and so embedding counselors over at places like that where students can have a warm handoff directly to someone with a mental health background.
We have a faculty member who does something called look up credit. So when the students are all filing in and waiting for the lecture to start, when they're not in their phones, but
Yeah.
looking up, he gives them 1 point of extra credit. That's really cool, right?
You press a lever and get a pellet. Yeah.
It's a message. And this is a hard science faculty member, not a psychology professor. So I think that, that's the kind of thing we need more of. What do you think, Kansas?
What we've really leaned into is the power of our students, right? And so a lot of students at our university sought out the HBCU experience because they were looking for community, right? With people who they presumed had more in common with than there were differences. And so seeking that community at an HBCU has really helped them to, it gives us a good starting place, I'll say. So it helps us to then lean into that desire for connection, desire for community, and say, let's use our students, right? Let's train our students, and not just our typical student leaders, not just our students in SGA, right, or our Royal Court kind of students, but let's use our students and train them in best practices for peer engagement around this work. So we implemented NASPA training last year for our peer leaders. We have some peer health ambassadors. We've trained them in UPN's resilience model, and then help them to roll out those trainings and really impact the students within their spheres, right? Both in the residence halls and beyond. And so I found that by leveraging the power of our students, right, who some come in kind of really passionate about mental health, others develop that passion through their own struggles, and some don't, right? They're just saying, hey, I want to be active. Like, what is something I can do, right? I have students who come to me a couple times a month and say, hey, kind of what do you have going on, right? And so we've really worked to leverage the power of our students, leverage their interest in the community and connecting with one another to help us really reach more of our students.
Esteban, we just talked about the fact that classrooms are vital, faculty are vital. I wonder how we keep faculty engaged at a time where they themselves feel so overwhelmed and who don't think that we're providing enough resources or infrastructure for them to do these kinds of things with the students, and frankly, the ones who say this isn't my job, this is what the counseling service is for. What have you done?
I've never heard that. I've never heard that. Well, I would say that we have a couple of approaches. One is that we do have some faculty that have made mindfulness part of everyday life for their students. And I have a faculty member who teaches German, and she said, nobody enjoys learning German. It is very difficult. And she then makes her curriculum builds around some mindfulness activities and exercises as part of the German experience. She said, even if they, are this much happier learning German, we're in a better place. I don't know, I don't speak German, but she said it's really not a great experience. And so I think having faculty members that have adopted kind of some of our practices, I think is really important, and giving them an opportunity to really take that to the other faculty members. Something else that we do, so we have a commitment to care that was our strategic plan, and that's where the hire of the chief medical officer came from. This happened on 21-22 when Dartmouth had I think 4 student deaths, and that was in 2020. And so that was something that was really shocked the campus, and I think helped us understand that we needed to really focus attention here. And so as part of that commitment to care, faculty training on support and identification is part of the work that we're doing. We don't expect anyone to be a therapist if they're a faculty member and not a therapist. What we expect them to do is to identify students who need support and what are the resources we call it.
Is it mandatory?
It is not mandatory yet, but we started that. We're getting there. And so part of it was, it's called Campus Connect. It's a 3-hour training. We will have a mandatory training we're rolling out for all faculty and staff, starting hopefully by the next term, the next academic year this summer. And we're in the process of developing that. It'll be online and it'll be shorter, but that'll be the intro that everyone has to take. And then there's the Campus Connect, and then there's a mental health first aid. So we've kind of stepped it up depending on what your role is with students. So many of our coaches, athletic trainers, others that are really frontline with students are taking the mental health first aid. Campus Connect then is really intended for faculty. And then we have the basic intro course that we'll have this summer. So.
We did a survey with Healthy Minds a few years ago with Sarah Lipson, who was sitting right there in her chair. And this is what the faculty said. They felt unprepared. They wanted the training. They wanted it to be short. They wanted it to be asynchronous. So I think you're sort of right there with what is expected. Candace, how do you work with the faculty?
So in similar ways, we have implemented a program called GUIDE, Guiding Universities in Developing Empathy, and it was developed by some researchers at the University of North Carolina at Greensboro. It's a 3-hour training as well, and so we've utilized that training to help our faculty members, and it's open to staff as well, but to really highlight faculty members' roles as being kind of first responders in many ways, right? Being on the front lines of engaging with students multiple times a week for extended periods of time, and really being able to build rapport and establish relationships, because students oftentimes reach out to them when they're in distress as well. And so we want them to understand how to connect with that student, how to care for that student in that moment, and then get them to a higher level of care when and if needed, right? And so we've really worked on leaning into the power of our faculty connections with students and staff as well.
So, Betsy, another thing that compels faculty is data, and frankly, compels finance offices. And so I wonder, how are we measuring our success in these kinds of programs that, are a little bit sort of nebulous sometimes? How do we, put hard data behind these initiatives?
Yeah, I mean, obviously that's a challenge, and there's a multi-pronged approach. So we've been engaging with our School of Public Health, which, utilizing the resources of the researchers all around us. We just had a keynote speaker last week for our Week of Wellbeing, Jamil Zaki, if any of you, Hope for Cynics, if any of you know of him from Stanford, great work. And they did a public health campaign around your peers actually want to get to know new people and help people in distress. Because most students had assessed, no one wants to meet new friends, and no one would help me if I were in distress. So those things that we used to use around drinking for social norming, now we do it for just meeting people, right? But his point was, I never thought to talk to the administrators who are actually in charge of the students and applying my research here at the university instead of just using students as subjects. But so we work with our School of Public Health around our resilience courses to assess the outcomes, and like P less than 0.0001 on the effectiveness of some of those courses around emotional distress, sense of resilience, et cetera. So those are home runs. But the population level metrics are a lot harder to move. Our flourishing scores, like everyone else in the universe, I think, but if you don't have these numbers, come and talk to me so I can figure out what you're doing. About 60% of our students do not meet that threshold for flourishing. And so Healthy Minds, NCHA data, we're at least circulating around with this coalition building with the help of JED, with the help of the Okanagan Charter and that U.S. Health Promoting Campuses Network around all the constituencies in the coalition getting on board with this is how we are defining well-being. We're going to put our stake in the ground on belonging, engagement, and flourishing, and now let's baseline. So that's where we happen to be developmentally. Some folks are further along than that, of course. But so measure and remeasure. But I also think we're talking a lot about pulse surveys. So not just these big 20-minute surveys. How do we catch people in the dining halls, right, et cetera? 10 questions. So we're looking at writing some of that. Yeah.
What do you think?
Yeah, so I echo much of what you said. We're looking at our Healthy Minds study data, which we completed in my first year, but also looking at our National College Health assessment. We are then moving into actually really recent in the last month or so, establishing an HBCU consortium of our HBCUs in North Carolina, because I think there's a lot of power in being able to work with other institutions, students with similar demographics, to really look at what are best practices for our populations, right? But then what we're doing is taking some of those questions about flourishing, about premature kind of stopping out, and then building some follow-up questions. So taking the questions from the kind of assessments, and then building out some follow-up questions and asking students what support, what resources, what engagement kind of helped you to stay, kind of shifted your perspective about, engaging in non-suicidal self-injury, right? So asking them some of the follow-up questions and gleaning information that we can't really get from our at-risk, kind of at-promise students who complete those surveys. So digging deeper with some kind of homegrown questions that we're asking. And then to Betsy's point, we're also engaging our students in some really kind of passive ways. So when they're going to our dining hall, when they're at UREC, we have a love affair event on Friday focused on self-care, and we are weaving in some type of assessment, quantitative or qualitative or both, in all of our engagements with students, right? And so they like gifts, and we give them gifts, and in exchange for their time. But we are gleaning a lot of data that sometimes I can't even go through, but we have it, and we have some, kind of protected time as health and well-being leaders to really be able to sit with that data and look at it and see what is it telling us, and now inform our next steps for engagement.
There's assessing flourishing, which you talked about, and then there's assessing the elements of flourishing. Ours are belonging, purpose, and well-being. And so our decision has been we can assess flourishing, but I think that we would be more accurate in our assessment if we assess the elements of flourishing as well, and at least compare it to how many people are saying that they're flourishing. Your thoughts on assessment?
Sure. So the commitment to care had 73 deliverables. It's a 5-year strategic plan, and as part of it, it says year 2 to assess. Well, that was great, but so how? So I think we're working on that. We certainly Healthy Minds. That was part of our initial when we launched the commitment to care, and now we just completed our follow-up. So we will be using survey data. We have a lot of process data. It's not great. It's not outcome data, but it's helping us understand how many faculty have we trained. What is the utilization rate of our wellness services? So there's what do students think? Feedback as well. I think all of that is important, but I think to be more specific, I really do like the idea of kind of utilizing every opportunity or some of those opportunities to engage students to get their feedback, and more of a qualitative, I think, is going to be important, not just quantitative, and that's something we're developing now.
So you mentioned the power of peers. We have a program called Listening Labs where students engage in this active listening exercise between each other, and we get a lot of really great feedback that students never feel that somebody's actually wholly listening to them versus waiting to talk. And so this is an exercise whereby you can't say anything but, is there more? And thank you for sharing. For 2 minutes, each person gets it. So, and we do an assessment. We do it before a feeling assessment. Do you feel connected? Do you feel like you belong? Do you feel, and then afterwards, and you really do see significant increases in people who feel better after, this exercise. I mention it because it's sort of part of the assessment conversation, but also there is a worry about peers and how we keep them safe as we use them to engage each other. And so I wonder your thoughts, because they will be very clear with you that their mental health is impacted when they hear about other people struggling. So I wonder your thoughts on how we can both use the power of peers, which is we have to do that, and also keep them safe.
I used to teach the course where we train RAs how to respond, and I also have been involved in many years in training clinicians. And the number one thing that you have to course correct for is the fix-it syndrome. And RAs, when they're doing their role plays, will just rattle off, like they were reading a website, all of the resources. And it's really a very medical model at times where, like, this is not me, I am the helper, you are the person in need of help. And sometimes that is the situation. But in our resilience courses, I think we're getting at more of a model where we're going to teach you a skill about resilience, you're going to practice it during the week, you're going to write a story about it, and then in your small group of 6, you're going to share that story. And it's this idea that I am not alone, I am part of a community of people who also suffer in this way or differently. But we're listening to each other's stories, similar to what you're saying. And I think that doesn't answer your question exactly about, of course, you can put the things in place, call someone if someone is making suicidal statements. We all know all the safety gaps. But I really think we need to challenge ourselves to move away from that model where I will give you the fix. Because the fix is us, right? And so I am not beyond that. I am not beyond the suffering of loneliness. It is me too, right? So.
Yeah, I appreciate this question a lot. I think for us, what we've really, one of my mentors said to me many years ago, about 15 years ago, when I first started graduate school, Candace, you don't ever center yourself in a client safety plan, right, or in a client support system. It's pretty egotistical to do that, right, and it's dangerous. And so I've held that. He mentored me for years. I've held that close, right. And so what I try to help students understand, as well as our faculty and staff, is that we're not building support around you. Right? This goes back to this public health approach, but we're helping them to understand that the level of care that a person is going to need, especially if it's, from an interaction that is kind of weighing on you, the level of care that they're going to need goes beyond you. Right? Your role is to engage with them. Let us as a community care for them, right? Let the systems that are in place care for them. And so that's one kind of core training piece that we've implemented with our students, our peer leaders or health ambassadors. But the other piece is making sure that we are in the room whenever we're doing these engagement opportunities, right? So when they have programs, they are designed by them, conceptualized by them, led by them, but we're in the spaces, right? And making ourselves available to connect with students as well. And that's also helped us to build rapport with our students. But those are two of the ways that I think we do that and care for our student helpers as well.
Esteban, what do we say to students who are perhaps from non-Western cultures for whom individual flourishing is not a thing? How do we sort of get them to appreciate the work that we're doing in this regard?
Sure, thank you. I think from our perspective, we need to be very individual, and we need to, as much as I think in the current climate, we're hesitant to over-identify some of our students as needing specific supports, LGBTQ potential students, international students, undocumented students. We're very careful now, but at the same time, I think we need to partner with student groups and student organizations to make sure we're meeting their needs. And I would say, similar to what I did when I was with the Department of Public Health, it's really looking at who the community trusts. And so I think that's really important. We do the same thing, when we went out to communities that weren't getting vaccinated or that were under-vaccinated, and they weren't going to trust Esteban saying, you should get a COVID shot. But they certainly were going to trust their barber or their priest or someone that in the community. And so that's the way we engage them. We've taken that model to Dartmouth, and we're doing the same. So we're working with those student groups to make sure that we hear what the students need and that they are our trusted messengers to the students. I think it's important.
Thank you. How are we doing for time? I have one more question. So we cannot lose the opportunity. You are sitting before a whole room of presidents, and I want each of you to give them one piece of advice as it relates to the well-being issue from your perspective. Go ahead.
We just are in the process of writing our university-wide strategic plan, and if you are in that position, nothing speaks louder than a mandate from the president.
I echo that, and a mandate, a calling into action to partner with your health and well-being leaders on your campuses. Community care or radical care is what we're moving toward, what we have to move toward, and we've got to be able to hear that from our top leaders at institutions so that people buy into this vision.
Yeah, I'm going to say the same. I think just having that ability, this is easy, right? I think from my perspective, being able to have a direct communication with President Bylock, with Sion, I think is really important. And at the same time, sometimes, it's understanding that I'm also a messenger for leadership and being able to bring that back. So it's a bidirectional communication is really important.
And mine is similar, except that I wholeheartedly believe that the faculty are at the center of this, because the students will always sit in front of faculty. They might not go to our programs, but they'll always sit in front of faculty. So how do we make it, how do we make them capable of this? From, embedding it into the tenure assessments and maybe taking other things away from them. But, obviously, senior leadership is really important in that. So we're up to the Q&A part of this session. Any thoughts or questions? Yeah. Hi.
Hi, Nancy Roy from the JED Foundation. To your point about faculty and what the comments were earlier about training, we work with over 500 colleges and universities across the country, and every time we sit with faculty, you can see the visible signs of relief when we say to them, we're not asking you to be clinicians. We're just asking you to offer a warm hand. When you see, Nancy's usually talkative in class and she's been quiet for a couple days, to simply say, hey, I see you've been quiet. Is everything okay? Know where to send me if I have an acute issue, but 9 times out of 10, it's that warm hand that makes a big difference. But I think one of the things we've done when you think about trainings is, as a field, we've done ourselves a disservice, because so many of those trainings do make non-clinical people feel like they need to be clinicians. And most of the time, it's not that people don't care, it's that they're afraid they're going to say the wrong thing, because we've made the stakes so high. And I think we have to remember, this is not rocket science. We're talking about basic human connection. And to have 3-hour trainings, 8-hour trainings, good luck getting your faculty to sit through those trainings when this much of it is really relevant to them. What about short, brief trainings, one for athletics, one for coaches and trainers who see kids in a certain part of life, one for faculty who sees, or one for security. I mean, we need to do a better job, I guess is my point, about in the trainings we offer, in the messages we're giving, if we really want to engage faculty. But I will say, in all the universities we work with, unless you have support from the top down and a campus-wide approach, you do not move the needle in any kind of long-term systemic way. So I'll stop preaching now.
I was going to say, so I had, to your point, I had a faculty member recently, I think computer science, who reached out, and I was able to read the entire email, which was a lot, but he was very upset about the 3-hour training because he didn't feel that it made him a therapist. And I said, okay, then I've missed this, right? I've got to go back and reframe about what that is for. And realistically, once we had a very good conversation, he was stressed about what to do in this situation when he really was concerned about a student. And then I have other faculty members who call me and say, my student hasn't shown up for two classes, and they call me directly, and I'm thinking, well, there's a whole lot of other people I got to get involved but I appreciate that response, because they know their limits. There's, it's an interesting place to be, but I do think we need to be clear about what the expectation is, and we don't expect them to have to solve the problem.
I guess I would just briefly say, and I've been working with JED for, I don't know, maybe more than 10 years, and we spend most of our time in the upper sections of that model, which is social connection, et cetera. But one of the unintended or intended consequences of bringing a coalition into the work is they start saying, wait a second, what about me? And we can't expect folks who are not taking care of themselves or being taken care of to take care of others. So one of the outcomes of our JED work was our UMass Police Department engaged with the Quell Foundation around secondary trauma and traumatic stress for our police officers, and have done really involved training with them. So they come to it willingly when they spend enough time in the soup, right? And so taking care of our faculty could be more of a priority, I would just say that.
So I just had Domenico Grasso, I'm Chancellor at University of Michigan, Dearborn, and I really appreciate everything you said. But, and we just went through strategic planning, and one of the things I'd like your thoughts on are, what are your key performance indicators of success? Because you can put this in strategic plan, you can have rhetoric around it, but if you're not able to measure movement, then you don't know if anything is working. So I'd like to know how you're measuring the success of these programs.
Well, like I mentioned, we're just in the process of nailing down outcome measures around things like flourishing, belonging. Engagement is very difficult, and it's triggered us to want to not just start swiping people into all of these different things that we're doing, so we know who's coming, and then at least starting to analyze who is not coming, right? So that will end up being, I think, part of our key performance indicators is that we're getting a broader section to our well-being efforts. We're moving the needle on anxiety, on all the things that we measure in Healthy Minds, and Sarah is helpful in helping us do that. And so I don't know if that's an adequate answer, but that's what we're going to end up with, I think.
I could add to that. In the Department of Student Affairs, we require that every unit, I can't see you. Hi. I know, and I won't be able to move this. We require that every department articulate KSIs as it relates to flourishing. So whether it's athletics or campus life or spiritual life, they have to say how their initiatives are matching up and lining up to this idea of flourishing, which again, are important elements are well-being, purpose, and belonging. So for well-being, we say utilization in our what we call wellness workshops. We have these feeling assessors, and we do it right after and then 6 weeks after. So did this program have a lasting effect afterwards? We do that with the training with the faculty too. Did I teach you something in the moment, and then did you retain any of this 6 weeks later? So those are the kinds of key success indicators we have in well-being, but every unit has to articulate their own.
And I'll add, we're using some similar KPIs. One that I'll add is we've implemented environmental scans as well, right? And so again, if I go back to this public health approach to doing the work, every space that a student encounters on our campus can impact their mental health, right? And so if we're truly doing the work in facilities, in dining, in, the residence halls, and all throughout our campus, then that means that students are going to perceive those differences, right, when they're in those spaces, right? At least they should if they're impactful. And that's everything from how we engage, but also the physical spaces. And so using the data that we're just collecting about our environmental scans, and it'll take us about a year or so to make our way through that process, but then having students revisit those areas and give us ongoing feedback about the changes that they've seen implemented in those spaces and how those spaces, and I keep saying spaces, but how the spaces and the people in those spaces can engage with them differently, or how they engage with those spaces differently.
You had a question?
Yes, aloha. Thank you to all our panelists. Lola Hong, I'm the inaugural Vice President for Student Engagement and Wellbeing at the Georgia Institute of Technology. I'm both the Senior Student Affairs Officer and the Chief Wellbeing Officer, and our focus is on well-being for students, faculty, and staff. So my question, and I sat here and realized, oh my gosh, this feels scary to ask because I work now. I came from California most recently. I wouldn't think twice about asking, but I work in Georgia now, so I am thinking about asking this. For us, the issue of health equity is so prevailing, right? So talking about all of this to overlay that equity framework, to me, is just as important in thinking about educational equity. And so I think about the context that we're in now that is so different is that rather than action at a state level, this is now a universal across the country level and its impact. So I'm just wondering, how are you either anticipating or preparing for the impacts of all the executive orders and what that might mean? Because all of us have some level of federal funding, right, regardless of our institutional type. How are you preserving that element of health equity in your efforts in the current context that we're in, including that we don't know if we can?
I'll start, and I'm in North Carolina, and our UNC system issued several months back an equality policy, right? And so I understand and I feel the tension. My staff feel it as well, and folks in our professional circles outside of the institution feel the tension, especially folks in our health kind of fields, to adhere into an equality framework, right? And in some ways, that being risky and dangerous for the students that we care for. And so what we've, and I've just received Department of Justice kind of funding for to address sexual misconduct and stalking, domestic violence, things like that, that right now we still have, but we may not tomorrow or next week, right? And so for me, it's pretty scary because I recognize, one, we have this guidance, right, that we have, and policy that we need to adhere to. We also have to, in some ways, as leaders, address this tension that our professional staff members feel, who are being called to do health equity work, but who are also being called to adhere to an equality policy. And then we have to figure out, I don't have $500,000 sitting at the institution. That money came from the Department of Justice, Office on Violence Against Women, to do this work, right? So how do I do this work without that? And in many ways, I can do pieces, but not the, synergistic work that we were aiming to do over a 4-year time period. And so for me, it's about looking at all those things, acknowledging where we are, but then still saying, hey, even though guidance, may not come from the CDC, right? You still have the CDC, right? Even though, verbiage has shifted, right? You still have those seminal kind of documents to reference, right? And helping people to realize that in our professional spaces, in our professional circles, we can still advocate and we can still lean on one another and use the expertise of folks who are still committed to health equity work.
What I would say is that I think acknowledging where we are is such an important statement because a lot of what we're doing in this particular moment is mitigating fear. We've had students ask us to expunge their health records. We've had students ask us to delete their pronouns. We've had our staff ask us to take down their pronouns off the website. So I think that one of the biggest things we can do, at least in this moment, is educate around what an executive order is versus a law. Not be the first ones to respond. Obviously, if there are laws that are put in place, we're going to abide by them. But in this moment, how do we make people focus on what is happening right now and that we are as fully committed as we ever have been, as opposed to sort of being 10 steps ahead when clearly we can't predict what's going to happen.
Yeah, I would agree. I think that the challenge is certainly helping students understand that we haven't changed our commitment to them, right? To their education, to their well-being, and making sure, and sometimes that's very targeted. I was speaking yesterday just about we looked at the transgender executive order and the concerns around, as a health center providing gender-affirming care, and then what do you do with that? Now, again, was there a reason to say 19? So what do you do with that? And that is going to impact. And of course, we're going to have to follow, like everyone else, what the laws are. But at this point, right, we haven't changed anything. But I think it's important for us to then, and my team felt like they needed to reach out to individual students, and we're a small college, so individual students who are receiving their care with us, but also what happens in the fall. Are you coming to campus, and anticipating that you're going to get your care if you're under 19, potentially? I don't want to get ahead of ourselves, but that is something we're thinking about to be ready. How do we engage students when and if this executive order stands? So I think it's a lot of individual engagement to make sure students know we're supporting their educational mission and their well-being.
I think all of those complexities for sure, and then also keep an eye on the data out of CCMH, the Center for Collegiate Mental Health, that illustrates the impact of oppression on students' mental health, and let's just keep measuring that, and we are serving to that, right, as well. So.
The last question we have time for.
All right. Who's going to have the last question?
That was the last question.
Oh, that was the last. Excellent. All right. Well, thank you very much. Thank you so much to our panelists.
My pleasure.